I'm going to talk a little bit about the basics of using Medicare, how it actually functions and what your out-of-pocket costs are when you go to the doctor, when you go to the hospital, how it actually works. And certainly understandable. A lot of people want to deal with health insurance about as much as they want to deal with their taxes. They just don't really understand how it functions and don't really want to know. They just want to know when they go to the doctor that there's not going to be a big expense involved with it. So I'm going to talk a little bit about kind of the basics within Medicare. A lot of people don't understand deductibles, co-insurance, copay, things of that nature that all go along with basic health insurance. And understand Medicare, really that's all it is basic health insurance. It's very similar to regular health insurance. It can be better than what you've had previously, and it's important to understand kind of how it functions. So it's not that complicated. Where you have Medicare is you have, if you're on traditional Medicare, original Medicare, Part A, Part B. Part A covers stuff that happens in the hospital. Part B covers stuff that happens outside the hospital. Simple as that. I don't really know why they break it into separate pieces, but that is Medicare Part A and Part B. Now there is Medicare Part C, which is Medicare Advantage, which kind of takes away Medicare A and B and puts it into a private insurance carrier. So it's a completely separate plan away from Medicare that, if you watch any of my videos, I never recommend Medicare Advantage. It's much too complicated, takes away a lot of your choice, takes away a lot of your flexibility if you find yourself in a significant health condition, which is certainly possible as we age. So I would 100% stay with a traditional Medicare, A and B, likely have a Medicare supplement plan. We're going to talk about that a little bit as well. And a Medicare drug plan, those are your pieces. So Medicare drug plan is Medicare Part D. So you have Medicare Part A, stuff that goes on in the hospital, Part B, stuff that goes on outside the hospital, Part C that shifts it away into a private insurance plan, and then Part D. Gee, hard to figure why this stuff is complicated, huh? And then not even mentioned as a part is Medicare supplement plans. But if you have A and B and a supplement plan, you've got really, really good coverage. So much better medical coverage likely than you've had previously. I just wanted to jump in for a quick second and invite you to join my private Facebook group, Talking Medicare, where you can get answers to just about any questions on Medicare and interactions with others that are also in Medicare. There are no agents, no sales whatsoever. It's absolutely free. Just visit talkingmedicaregroup.com. It'll take you right there. You can sign up for free. Easy to do. Enjoy the video. So let's assume we have Medicare Part A, Medicare Part B, original Medicare with a Medicare supplement plan and a Medicare drug plan that'll go along with it as well. When we go to the doctor, so let's talk about outside the hospital first. Medicare Part B has a deductible. It's $226 right now for the entire year. So what that means is when you go to the doctor's office, when you go to outpatient surgery, anything that's going on outside of the hospital, from January to January, you're going to be responsible for the first $226. That's the deductible. Now let's assume we have Medicare Supplement Plan G along with our traditional Medicare. Plan G covers pretty much everything except that $226 deductible. So if you have A, B, and a Medicare Supplement Plan G, for the entire year of January to January, your out-of-pocket expense is $226. Once you've met that $226, Plan G is going to cover everything that Medicare doesn't cover. So under Part B, you have that deductible, and then Medicare, after the deductible, pays 80%, and you're responsible for 20%. That 20% is called co-insurance. So that's the percentage that you're responsible for. But if you have that Medicare Supplement G, it covers the whole 20%. So you only have that deductible of $226. I mean, it's really almost too good of coverage. It really, you know, obviously we've got financial issues within Medicare and other things like Social Security. But right now it's fantastic. So we don't want to mess with it, and it's likely not going to get messed with. So it's going to be that good likely going forward. Now let's assume you have Plan N instead of Plan G. And that's the things that we help you figure out is what makes more sense on a supplement plan, either G or N, depends on the premium, depends on where you're located. But there's not a huge difference between the two. Plan M acts just like G. It covers things not included in the deductible, so you're always going to be responsible for that $226. That $226 will go up a little bit every year. So right now it's $226. And then on Plan N, if that's what you have as a supplement plan, when you go to the doctor, there's going to be a $20 copay. And it actually is classified as up to $20 copay. So a lot of times I've seen it where it's $13 or $18, but we'll assume that it'll be a $20 copay. And then if you go to the emergency room, it's a $50 copay. So that's your out-of-pocket expense with a Medicare supplement. Plan G, only the $226. Plan N, the $226 and a copay when you go to the doctor or the emergency room. Plan N also does not cover what's called excess charges, but I've never really found this to be an issue. Excess charges are the difference between how a doctor contracts with Medicare. They either take Medicare assignment or they do not. If they take Medicare assignment, then they agree to be paid in full by Medicare. If they do not take assignment, then they do have the ability to charge 15% on top of what Medicare pays them, which isn't as bad as it sounds. If it ever comes along, it's usually $10, $12, $15. But if the premium for N is enough less than G, then it makes sense to have that as long as we know about it. So here we have a $226 deductible. The coinsurance is the Part B 20%, but if you have G or N, covers that coinsurance completely. And then a copay on N, where it's $20 to the doctor, $50 to the emergency room. That's the extent of that. Now, if we go into the hospital, under Medicare Part A. Medicare Part A has a big deductible. It's $1,600 if you're admitted into the hospital. But supplements cover that. G and N cover that 100%. So there is no Part A deductible if you have Plan G or Plan N. So if you're admitted into the hospital, you likely have zero out-of-pocket expense because there's nothing outside of that $1,600 deductible going into the hospital. So it's terrific coverage, and once we get it right and get it set, then it makes all the sense in the world, and you'll literally almost enjoy going to the doctor. You might not enjoy going to the hospital, but from a financial standpoint, you will, because it is almost 100% coverage as you go. Now, if you add on Part D for Medicare drug plan, which likely is going to make sense, it's a little more complex. And I have videos on that. I have videos that show you how to get one, how to set it up direct, so you don't have to have somebody sell you something that might not be the best one for you. But we walk through all that. So that's exactly what we do. So I hope you'll visit my website, MedicareOnVideo.com, put in your basic information. We'll email you a quote on the best Plan G and the best Plan N in your zip code. You'll see exactly what it costs. But what we want to do is stay somewhere around $100 a month for the supplement plan. So if you have your Medicare Part B, right now it costs about $165 a month. Supplement plan, hopefully we're going to be less than $100 a month. And a drug plan can be as low as $10 a month. So hopefully we'll put everything together and it'll be $300 a month or in the neighborhood, maybe less than that, for really, really good health insurance. And that's what Medicare is. It's health insurance. So don't let the terms confuse you. That is all it is health insurance. And the way traditional Medicare works and runs, I mean, literally, I have thousands of clients and I get zero customer service phone calls. I don't get any calls that say, I've got a problem here or a problem there, or this isn't being paid for. It runs very, very well. The only call that I might get is, I lost my card. I need another card. Medicare Advantage, different story. If I did sell Medicare Advantage, I certainly could. I'd have to have a staff of customer service people to deal with the pre-authorizations and the denials and everything else that's part of it. My doctor left my plan. You know, with original Medicare, you don't have any of that. You can go to any doctor anywhere in the country at any time that takes Medicare without asking for permission. And that's one of the main reasons why I would absolutely want to be, and again, when you're healthy, not that big a deal. When you become unhealthy and you need specialist A or specialist B, or you want to go get another opinion, or you want to try this because you want to possibly save your life. I mean, you just want that kind of control with your health insurance, and Medicare gives that to you, and it really is autonomous. They don't get in the way at all. If your doctor says you need something and it's medically necessary, it's covered. And if Medicare covers it, supplement has to cover it. There's no decision from a supplement company on whether or not they cover something. If Medicare covers it, they have to cover it. So I hope you find this helpful. We're happy to help. Make sure you join my private Facebook group, Talking Medicare, where we discuss stuff all the time. It's a very easy way to kind of get answers to questions that you might have without even really asking them. You'll see everybody else that asks questions or shares experiences that they've had with Medicare. Just go to talkingmedicaregroup.com. It'll bring you right to my group page. Just join. There's no cost. It's all free. Everything else I do is free. Make sure you download my book. Hope you found this helpful. Have a fantastic day. Thank you for taking the time to watch my video. I hope you found it very helpful. A couple of other things that you'll also find very helpful. Number one, download a copy of my free book, Medicare Made Clear. I spent a lot of time and a lot of effort putting this together, and it has everything that you need for Medicare now and in the future, down the road. I have videos in the book. I have all the links that you need for things that you'll want to do within Medicare. You can access it right in the book. Very easy to do. Just visit medicareonvideo.com/free book, and you can download it for free. You can save it on your computer. You can save it on your iPad. It's a great resource to have, again, for now and in the future. Another thing that you'll find helpful is down the road, when you come into Medicare, sometimes it makes sense to do a price check on your Medicare supplement plan. So I made it very easy to do that as well. Just visit medicarepricecheck.com, put in your basic information, and we'll email you a quote on your same plan that you have right now, a G or an N or an F, whatever it may be. And likely we'll be able to save $20 to $60 a month in premium, because a lot of times plans come out with better rates. So if we can get a better rate for the same plan that we currently have, just makes a lot of sense. And then obviously take advantage of all the information on my website at medicareonvideo.com. I have everything that you need right there for understanding IRMA, understanding employer work coverage, everything that you need, especially in the guides and forms section, you'll find right there. So we update everything every year, so everything should be up to date and current with the right deductibles and premiums and things like that. Hope you found all this helpful. Have a fantastic day. Wait, don't go anywhere. There's a couple more videos right here that you'll find very helpful with your Medicare journey. So take just a minute, watch the videos. You can also subscribe to my channel by clicking this button, and that way you'll have access to all my videos for everything that you need for Medicare. Hope you find it helpful. Have a fantastic day.